CPT surgery section, respiratory system. And to understand these procedures, you have to review, revise your the knowledge of anatomy and physiology of part. Every section, every body system, you have to review a couple of times, especially the surgical anatomy. All right. So let us just quickly review. As you know, the respiratory system, it starts with nasal cavity, and nasal cavity. After nasal cavity, we have the pharynx. Pharynx is divided into three portions: nasopharynx, oropharynx, and laryngopharynx. So next to pharynx is larynx. This is a voice box, and so voice box. Next to that, here is the trachea, and then bronchus, right bronchus and left bronchus. Then we have the bronchioles, bronchial tree, what we call, and two lungs, right and left lung. There are three lobes in the right lung, the upper, middle, and lower lobe. On the left side, we have two lobes, upper and lower. And the pleura is the structure which covers entire lung, right? What we call pleural sac. Uh, so this is the anatomy of respiratory system at the very high level. And this diaphragm, muscular portion, which separates um, the trunk into two parts, chest and abdomen. So which helps in breathing process. Go through these different parts of the respiratory system, and especially in the nasal cavity in the head region, what we have is paranasal sinus. They're the very important structures, the hollow air-filled sacs within the bones. So we have four pairs of paranasal sinuses, right? This is frontal sinus, which is located in the frontal bone, the skull bone, and ethmoid sinus within the ethmoid bone, sphenoid sinus within the sphenoid bone, maxillary sinus within the maxillary bone. Right side and left side, these are the bilateral organs, very important structures. Sinus. Yes, let us see the procedures on the respiratory system, right? So, any specialty, you can divide these procedures into. So, office based procedures. So if you go to any surgical section, you have three types of procedures: office procedures, daycare procedures, and inpatient only procedures. What do you mean by office procedures? Which are done in the clinic. So that will be done within 10 minutes, 15 minutes, maybe under local anesthesia or without anesthesia. That is possible. They are all office procedures. Then we have the daycare or same day procedures. Or same day procedures. What do you mean by same day procedures? Patient is admitted in the morning, maybe at 6 a.m., 7 a.m., and procedure is done usually under anesthesia or sedation, and patient will leave the hospital on the same day. Usually minor to moderate procedures. That is same day procedures. Whereas inpatient only procedures, very complex. You have to admit the patient, and patient has to stay maybe 2 days, 3 days, or 5 days, depends. So you will understand. Of course, you will slowly understand. Some of the procedures are easy to understand that they are office, they are same day procedures, they are inpatient. Okay. So in respiratory system, let us see one simple procedure. For example, a kid is brought with foreign body in the nose. FB in the nose. Usually, it's in the family medicine clinic or pediatrics or ENT clinic. Kids are usually brought with the foreign body in the nose. So the physician will do the removal, right? Removal of foreign body in the nose. This is a procedure. Can you find the code for this? Please go to your CPT, the 30,000 series codes.
30300.
30300. Yes, you're already there. 30. Once again, please. What is the, yes, 30300. Removal of foreign body, right? So this is how you're going to find the codes. And it's an office type procedure. Sometimes the kid is not cooperative, so they do under anesthesia also, short anesthesia. That is 30310. And there is a more extensive procedure. They do rhinotomy. Rhino means what? Nose. Otomy is opening, right? So they do a surgery to remove the foreign body. That's also possible. So that's how you're going to find the books. Let me check. Someone is going to join. Try to join now. And there are other procedures, also surgeries on the systems. Other classification. For example, there is the one. This is two. This is, we have different classification also, different type of classification. That is open procedures, percutaneous procedures. Then we have endoscopic procedures or endoscopy. So you should also understand, if a procedure is done, what type of procedure is it? Is it open procedure or endoscopic or percutaneous? So I'm sure you know the difference. So we're going to see these type of procedures in here afterwards, right? Um, Within the nose, within the upper respiratory tract. So usually we divide procedures into procedures on the upper respiratory tract as well as lower respiratory tract. Upper respiratory tract, which includes nose, pharynx, and larynx. These procedures on these three organs are done by ENT specialist, ear, nose, throat, right? But procedures on lower respiratory tract are done by the specialist pulmonologist. And also, if it is surgery, cardiothoracic surgeon. So this is the scope of different specialties, right? Let us talk about the upper respiratory tract, which is the nose, pharynx, and larynx. They say. So within the nose, nasal endoscopy, very important procedures. Nasal endoscopy, nasal or sinus endoscopy. ENT surgeon, they will do very routinely nasal sinus endoscopy. I'm sure you heard about the sinusitis, chronic sinusitis. So they do all these procedures. Other day when we are talking about endoscopy procedures, arthroscopy, what did we discuss? Endoscopies of two types, right? What are the two types of endoscopy procedures? Wherever you do endoscopy procedures, there are two types: diagnostic endoscopy and surgical endoscopy. The same thing you are going to see in this nasal or sinus endoscopy. to your CPT book, here you're talking about this heading accessory sinus. You'll find all types of procedures under sinuses under this heading. Now, so you have your endoscopy procedures from here. So if you look at here, 31231 nasal endoscopy diagnostic. This is sinus endoscopy diagnostic with maxillary sinuscopy. So like discussed, you're going to see procedures on each, what do you call, sinus. So there are so many diagrams given in this CPT, very important diagrams. You would always, follow these diagrams. So the surgeon, ENT surgeon can do procedure on frontal sinus, or ethmoid sinus, or sphenoid sinus, or maxillary sinus. Depends. The largest is maxillary sinus. So the patient is coming with severe facial pain, headache, nasal discharge, chronic cold. They do these procedures. So that is nasal endoscopy. So this is the sinus endoscopy what we are talking about. This is an endoscope instrument, and diagnostic endoscopy to detect any abnormality. If any abnormality is detected, they'll go for a surgical endoscopy. So go through all these nasal endoscopy procedures. So we have combination codes for different types of procedures. For example, 31237 nasal or sinus endoscopy surgical with biopsy. Polypectomy. Polypectomy is removal of polyp. What is polyp? A growth, swelling. So that's the kind of procedures you'll see. And you come across a lot of new procedures. So radio frequency ablation. Ablation means removal with energy. All that you have to do is keep a heading nasal or sinus endoscopy, and you have to learn all these procedures. If you come across a new word, explore, do some research. Most of them are self-explanatory. If you know the anatomy, yes, all these procedures are the what you call self-explanatory. But if you are struggling with anatomy, then it is a bit difficult. Right. For example, some people, some individuals, they come with bleeding from the nose. What is the medical terminology for bleeding from the nose? Epistaxis is the term for bleeding from nose. So if a patient is coming with bleeding from nose, you have to stop it, right? The ENT surgeon will stop it. If with the help of endoscopy, if you are stopping bleeding from nose, what is the code? Yes, please. So how do you solve it? You have to go through these codes one by one. That's the only way. You can also get the codes from the index, but instead of going there, you can directly. You have very limited number of codes, maybe two, 3 pages. You have to go there and identify the code. So, for example, 31238 with control of nasal hemorrhage. Nasal hemorrhage means nasal bleeding. Okay. So go through these procedures a couple of times. And so, for example, 31. What is the code? Discuss 31. Yes, 31238, right? 31238. This is endoscopy procedures. This is endoscopy. But even without endoscopy, also, you can control the bleeding from nose. So, what you have to do, what the surgeon will do, if there is a bleeding from nose, they'll put the packing, cotton gauze, and they take that packing, they put it in the nose, either from the front or from the anterior side or posterior side. That is called nasal packing. Can you give me the codes for control of hemorrhage, nasal hemorrhage or epistaxis with the help of packing, anterior and posterior packing, not endoscope. So we are talking about nasal hemorrhage, right? We are in CPT. So your heading is nose under respiratory system. Then you have to go to, you have to look for procedure where the surgeon is trying to stop the bleeding. This is 30901. Control nasal hemorrhage anterior. Then if it is simple method, 901. If it is complex, 903. Then if it is posterior, 905. So these are very important procedures. They can do in the outpatient. So you have to underline or highlight those important codes. But if it is done through endoscopy, the code is 31238. All right. So go through these nasal endoscopy. Then next organ within the respiratory system is larynx. Okay. So larynx is voice box, right? So if there is a ENT surgeon will do procedures on larynx, voice box. Among the all those procedures, what is important is laryngoscopy. Laryngoscopy. This is a laryngoscope instrument. So surgeon, so through the mouth, he's inserting it, and this is the larynx. He's visualizing. ENT surgeon is visualizing the anatomy structure of larynx. So you'll find vocal cords within the larynx. So what you're looking for basically, again, laryngoscopy. When we say laryngoscopy, what are the types of laryngoscopy? Endoscopy. Basically two types: diagnostic and surgical laryngoscope. So that's what you have to tell. Surgical, diagnostic. So we have separate course for diagnostic laryngoscopy as well as surgical laryngoscopy. And unique to laryngoscopy, we have direct laryngoscopy, indirect laryngoscopy, as well as flexible fiber optic laryngoscopy. Let us go to your CPT, the larynx. So here is the larynx heading. We have open procedures as well as the endoscopy procedures here. So laryngoscopy, indirect, diagnostic, these are all surgical. This is indirect, this is direct, diagnostic as well as surgical. Then we have fiber apt, 31575, laryngoscopy, flexible, diagnostic, and you have surgical procedures. What are the surgical procedures under any endoscopy? Biopsy, removal of foreign bodies, removal of tumors. These are the very common surgical procedures in endoscopy. Please make a note. Diagnostic laryngoscopy, then surgical laryngoscopy. Under surgical laryngoscopy, biopsy, removal of foreign body, removal of tumors. Very important. So you're going to come across this type of procedures. So this is flexible laryngoscopy. So this can be inserted through the nose or mouth, and this is the larynx area. When you see the larynx, you'll be able to see the epiglottis as well as the vocal cords, esophagus. Esophagus is behind the larynx. So you'll come across cases like laryngeal cancer, tumors that can be removed with the help of this flexible laryngoscopy. So the procedures on larynx, different parts, removal of abnormal tissues, all this, right? Okay. So the next organ is trachea. Here, what you see is the larynx portion. Next to this is the trachea. Within the trachea, one common, important procedure is what you see tracheostomy. What is ostomy? I've given you the surgical procedures, techniques in the very beginning. What is ostomy? Artificial opening, right? Artificial. So when do they do these procedures? For example, a patient has laryngeal cancer. What happens? The patient cannot breathe because here there is an obstruction. Here is the larynx. Because of the tumor within the larynx, patient is not able to take breathing. So as a temporary measure, what they do until this tumor is removed, this is a trachea. They create a hole and they put a tube. Now patient starts breathing from this tube. So breathe in, breathe out. Instead of happening this from the nose, breathing will happen from this. This is called tracheostomic tube. So we have codes 31601, 31603, 31605, 31610. Emergency tracheostomy as well as elective tracheostomy. Please go to your CPT for this codes 31601, 600, 603. All right. Next is lower respiratory tract. So we covered the procedures on upper respiratory tract. Now we are moving to lower respiratory tract. So we covered nasal endoscopy, sinus endoscopy, laryngoscopy, then the procedures on trachea, common procedures. Then we are going to the lower respiratory bronchus, bronchioles. The common procedure is bronchoscopy. Pulmonologist, they will do bronchoscopies. So if you are working with a pulmonologist, you will see every day at least 3, 4, 5, 6 bronchoscopy procedures. Again, this is a type of endoscopy procedures where bronchoscopy is a tube, camera, there's eyepiece, and through which an instrument will be paused to take the biopsy or removal of tumor, and also you can monitor, you can visualize in the monitor also. So this is bronchoscopy. Like I said, all endoscopy procedures, bronchoscopy is also two types: diagnostic bronchoscopy, surgical bronchoscopy. So this is a code range 31622. We have a number of codes, so many codes. So what is the code for diagnostic bronchoscopy? So here we are, bronchoscopy. So endoscopy procedures 31615. Yes, what is the diagnostic bronchoscopy code? 31622 is the code, right? Bronchoscopy, rigid or flexible, diagnostic with cell washing. Cell washing is included within the diagnostic. Then brushing or protected brushings, BAL, what you call bronchial alveolar lavage. If you're taking biopsy, then this is the code 31625. Sometimes, foreign body also you'll find in the bronchus. Some kids are, they inhale small foreign bodies. They'll go and settle in the bronchus itself. Breathing will be difficult. That's when bronchoscopy is done. It will be taken out. The same thing might happen in the adults also. So, what is the code? Removal of foreign body with bronchoscopy. Foreign body removal with the help of bronchoscopy. So, if you see here 31635 with removal of foreign body. So, these are all child codes. The the main code is the primary code is 31622 from here. So go through this bronchoscopy. This is important. Yes, you will get at least one or two.
So balloon occlusion, 31634, it says balloon occlusion. So it's also type of biopsy.
31634. Yeah, this is basically occlusion. What is occlusion? Occlusion means you're closing something. Your there's a see entire bronchus is a tube-like structure, right? There's a tube-like structure. So you're closing it. That is occlusion. For what? Air leak. The air is going inside to the in the process of breathing in, but air is going outside because there is a rupture. Maybe it's a rupture. So that's when the surgeon is trying to close the leakage. That is with the help of balloon. That's the kind of procedure. That is 31634. Usually with the help of fibrin glue. What is glue? Glue is like any other glue, but it's a surgical glue which can be used within the organs. That's a kind of glue. Because there is a leakage, you're using glue. That is 31634. So this is a super specialty. Pulmonology is a super specialty. You'll come across a lot of procedures, and some are done very routinely. Some are done very rarely. So you should be able to identify which is done routinely and which is done rarely. Like I said, you have to remember this any endoscopy. Like I said, what procedures you have to remember? Diagnostic endoscopy, surgical endoscopy, three procedures: biopsy, foreign body removal, then the removal of tumors. These are very common. Remaining, they are very rare procedures. Removal of foreign body, yes, that's common. So, if you are coding for pulmonology, for example, yes. because you are focusing on only pulmonology. That's when you do research. You have to go through every code because you're trying to master the entire bronchoscopy, right? All right. But if you have time, absolutely, you can spend your time on every code. Yes, you can do research, and like I said, most of them are self-explanatory, based on the anatomical knowledge. So this is bronchoscopy. Then what we have, some other procedures in the chest region, thoracocentesis. So what we learned, the pleura is the covering layer around the lungs, right? This is called what you call pleural cavity. Normally there is a thin fluid, minimal fluid you'll find in the pleural cavity. But because of infection, fluid will accumulate within the pleural cavity. What do you call that condition? Pleural effusion. Effusion means collection of fluid. Now, because the fluid is accumulated, this is causing pressure on the lung. Now, this lung is not able to breathe in. Patient gets breathlessness. So that's when what you do with the help of needle. So the surgeon will take out the accumulated fluid. That is called thoracocentesis. Thoraco or thoracentesis refers to opening, aspiration from the thorax chest. 32554 is all the course. You have access to these PPT. Yes, you can go through this. This is very important. Thoracentesis. 32554, right? Thoracostomy. The same procedure. See, if it is minimal fluid, one time you can take it out and patient will be all right. But if it is a large fluid, you have to drain this continuously over a period of 3 days, 4 days, 1 week. What they do, they keep one catheter inside and tube inside. The end of the tube is connected to one bottle which collects the fluid. So that is called tube thoracostomy 3255. So this is, if you see here, this entire lung is collapsed because of large accumulation of fluid within the chest. Pleurodesis. You have seen arthrodesis, right? Similarly, you have the here pleurodesis. What is desis?
Fusion.
Fusion.
uh,
Fusion, right? So here in the this pleural sac, because of some disease, what happens? You'll see accumulation within this space. They do their best to prevent, but if there's no relief, what they do, they will fuse this sac with help of some chemical agents, so there won't be any fluid accumulation. That is called pleurodesis. So you'll have some codes. Then finally, we are with the procedures, surgical procedures, major surgeries on thorax. In the sense now, lung, basically, lung as well as pleura. What do you call this? Is video assisted thoracoscopy surgery, VATS, or simply you can call them thoracoscopy procedures. Thoracoscopy, it is just like laparoscopy. So if you, this is endoscopy, you're doing in the thorax, chest region, that is called thoracoscopy. The same endoscopy, if you're doing in the abdomen, what you call this is laparoscopy. Laparotomy, laparoscopy. Thoracotomy, thoracoscopy. That's how it is basically. So how they do it? They create three holes, just like arthroscopy. You have seen arthroscopy, right? The same thing here they are doing on the chest. That is thoracoscopy. Even thoracoscopy is also again two types: diagnostic, surgical. Can you give me the code for diagnostic thoracoscopy?
32607.
Thoracoscopy with diagnostic
No,
biopsy.
that is biopsy.
Biopsy, yes. The very first code, E1 32601, thoracoscopy diagnostic. So they're trying to detect disease in the lungs, pericardial sac, mediastinum, pleural space without biopsy. If they do biopsy, that is surgical. Now, with the help of this thoracoscopy, they can do a lot of procedures, major procedures.
But
They
sir,
can
like
remove,
32607, it's like diagnostic biopsy. That means like,
yeah, biopsy itself is a diagnostic basically. When you say biopsy, that means you are taking a small piece to diagnose. That is diagnostic biopsy. So diagnostic biopsy doesn't mean it is diagnostic thoracoscopy.
okay.
Okay.
But I thought like biopsy means like that it's surgical, no?
Yes, it is surgical one. Anything other than see, this is only diagnostic. They are not doing any major procedures, but remaining all they're all surgical. From 32604 to we have almost 32674. These are all surgical thoracoscopic procedures. All right. So what are all the procedures, possible procedures they can do? They not only do biopsy, but also, for example, this portion is totally, there is a big tumor in this lobe. They can remove entire lobe, or they can remove entire lung also with the help of this thoracoscope. That's also possible. So go through all these individual codes, understand the differentiation, biopsy codes, lobectomy codes, all these procedures. Um, these are all endoscopy, thoracoscopy. But the same removal of lung you can do in open procedure also. That is called thoracotomy. So we have separate codes for thoracotomy, separate codes for thoracoscopy. All right. So that's how it is basically. So lung resection, for example, this is a taking out small portion, the segmentectomy. One segment they're removing it. Lobectomy, entire lobe is removed. Here, in this case of entire lung is removed. Pulmonectomy. So there is a difference. This is thoracotomy, open procedure, whereas this is keyhole surgery, thoracoscopy, separate codes. All right. Some non-specific procedures also we have in this. This is about your respiratory. Respiratory system is relatively smaller systems because it is respiratory system is confined to head and chest region only. We have a limited number of organs. So nose, nasal cavity, pharynx, larynx, trachea, and bronchus, lungs, pleural. So, all right. Any questions from this respiratory or previous chapters?